So, doctor, what are the effects of being on in the ICU and on a ventilator? What are the side effects?
So there's short-term complications, there's long-term complications, right? So short-term ICU, being on ICU with an intubated tube, the tube itself puts them at risk for pneumonias, what we call as ventilator-associated pneumonias. Give me 1 second. So ventilator-associated pneumonias, the pneumonias every day intubated after fourth day, the curve goes up like this. So it's basically you're putting them at high risk there. And also a lot of these sedation medications and the medications we give, that can also cause significant confusion, what we call as delirium, which is also a problem in the ICUs due to sedation related or medication related. So that's something we try to manage very closely. And then you have muscle weakness. So basically people are sedated deeply with medications, and then sometimes they need paralysis. So all those things can cause muscle weakness. So those are short-term complications. And long-term, it's similar. The pneumonia risk is still high when they have tubes like a tracheostomy tube, or even if this oral tube came out, they still need a tracheostomy tube, which can also put them for complications like pneumonia. There's also long-term muscle weakness, which is a big problem. And then there's a PTSD-like syndrome, what we call as post-ICU syndrome. This is almost going like going into a war. You're only fighting for your body, fighting for yourself, compared to the war where people are fighting for the countries, right? So you're basically still going through a lot of trauma, and that trauma causes almost like PTSD kind of things. Especially when they are discharged home, they're having these nightmares, visual hallucinations, and kind of all those things can happen.
Mm-hmm.